Welcome to another episode of Smile is in the Air, your oral health and prevention podcast. We are here at season 3, and with me I have Dr. Takeuchi. Dr. Takeuchi is part of the Japanese Society of Periodontology and an instructor and director of Takeuchi Dental Clinic. So, thank you for coming.
Nice to meet you again.
Nice to meet you again. It's a pleasure to have you here, all this way from Tokyo, too. So, can you tell us a little bit about you? So, who are you, and why you became a specialist in periodontology?
Okay, so my name is Yasuko Takeuchi. I became dentist almost 42 or 43 years ago. So that means just a long experience in dentistry. And when I opened my dental clinic, it's a private clinic, uh, I I could catch just in Sweden just prevention is already going, so then why not to take a prevention so at my clinic. Then just I visited Gothenburg in Sweden.
Yeah.
So it was the first time to visit Gothenburg. Then just I learned periodontology and cardiology, and also just bring back to Japan, and also I performed just at my clinic by myself,
Yeah.
and also educated to my dental hygienist. Then just my dental clinic changed so immediately, and also everybody are interested in such like a prevention and prophylaxis. So it was happy to me. Then just my tutor was Professor Jan Benström.
Yeah.
He recommended me to start SDA Japan in Japan, just as a first SDA in Asia. So it was in 2007 or 8,
Oh, that long ago.
long time ago. So then just I started to SDA Japan. At the same time, just I visit Nihon here every year, just together with dentists and dental hygienists who are interested in prevention. So real prevention, I
Yeah.
mean. So then just this is 19 or 20 times, just this is a 20th maybe, visit here.
Oh,
Yeah.
oh. So it's been a while.
Yeah.
And why came that you went to Sweden to learn about prevention?
Because of they have a good reputation in periodontitis.
Yeah.
Treatment of periodontitis. So then just learning about periodontology, prevention is must priority. Yeah.
Should be the
So
priority.
yeah. So that's why just I took prevention.
And how was to implement this European prevention in Japan?
Yeah, so it's a nice question. Because in Japan, we started regular visiting. I mean, just a patient regular visiting a dental clinic. Just now.
Just now.
Yeah, before just we had nothing. We had nothing, unfortunately. Of course, some dentists they recommended to regular visiting or maintenance. We call it.
Yeah.
So, but didn't work so much.
So that's why you also created the Swiss Dental Academy in Japan,
Yeah.
right? To teach other
Yeah.
clinicians for the prevention.
That's right. Yeah.
Was this easy? I don't think so.
Very tough job. Tough working to me. So, but day by day, just changing. So this is good to me, and also because of my working is just in the practice with practice. So this is a basic, and also the other side just based on science. So this is very important. That's why it's very good. Much to SDA.
Yeah.
So it was very enjoyable working just me, because I can study and I can give a nice result to patients.
Yeah.
So this is very nice to me. So that really effective. So of course really tough working, but interesting, and I enjoy my life.
And I saw that when 2022, when I had the opportunity to pass by Elva in Tokyo
Yeah.
and visit one of the classes that you were teaching, you were just vibrating, and
Yeah.
people were taking notes like super seriously. Normally here in Europe, you don't see this in the postgrad schools,
Yeah, yeah.
but you could see in your school. Why? How you get this connection with the clinicians?
So maybe I think just so many dentists and dental hygienists, they are really thirsty.
Thirsty for knowledge.
Yeah, for knowledge. Yeah, I
Yeah.
think so. So that's why just I provide the knowledge in science-based knowledge and also how to perform just to patients.
Yeah.
So both of them. Yeah,
And not only
this
that,
is
like
SDA.
you then you create also a community, because every year you are coming here with a group from Japanese clinicians, even to know more about prevention, about
yeah.
guided biofilm therapy, how to apply it in the hands-on. So why this approach?
Yeah, I think just they are looking for the European style or just a little bit exhausted in Japanese style. So that's why. So conventional way doesn't work.
Yeah.
So they could understand it. So that's why they want to change. That's why just they visit here.
Yeah, so to change, to
Yes.
be able
Yeah.
to bring this modern prophylaxis to Japan.
Yeah, that's right.
And you see this shift in the Japanese community, that they are shifting for the prophylaxis?
I think shifting to prophylaxis among young dentists.
The young dentists.
Young dentists.
So you are on with your eye in the future. That how you think you're gonna go this evolution in dentistry in Japan?
Yes, I think just Japanese people they perform just toothbrushing just really intensively.
Yeah.
3 times per day, otherwise 4 times per day, otherwise just any time just after meal. So
Yeah.
so such like really intensive toothbrushing.
With
Nevertheless,
hard toothbrush. Okay.
not hardened. So up to their prefer.
Oh,
So,
okay.
but anyway, just 3 times, 4 times, 5 times, such a frequent toothbrushing just among Japanese people.
Whoa.
So too much.
Too much.
Too
yes.
much. So then just maybe just nowadays everybody toothbrush just at least twice per day. So it's
Okay.
enough. But nevertheless, just we have so many periodontal patients.
The periodontal is a
affected
issue there.
patients.
Yeah.
So it's so interesting. So then, just in the future, we have to change such like a how shall I say so condition in order to reduce the patients with periodontitis. So then, just in order to reduce periodontitis, gingivitis, we have to find gingivitis. This
Yeah.
is the first priority. But so many people are not interested in gingivitis.
Yeah.
So this is my headache.
Yeah, people want to focus in the most
Yeah, more
complicated,
deep pocket,
yeah.
complicated percussion involvement like that. But basic is just gingivitis must be there.
Yeah.
So then just I want to control such like a gingivitis following to infection control, concept of infection control. So then just maybe in the future, just we can reduce the patient with gingivitis.
Yeah.
Then just periodontal patients will be decreased.
Decrease, yeah, because gingivitis you can recover from it,
Yeah,
but you cannot recover from periodontitis.
A little bit difficult in
Yeah.
the case with deep pockets and also long time.
Yeah, and
So,
once
yeah,
a periodontitis patient, always a periodontitis patient. So they always need to be in tough
You think
control.
so?
I
No,
think
I don't
so.
think so. I don't
Really?
think so.
Why?
Yeah, because once they have a problem, they lost such like a problem, so solved the problem. So in that case, just nothing was changed, nothing was different with the healthy patients
Yeah.
because of the gum doesn't show just bleeding. It's okay. It's enough.
Yeah.
It's enough. But most of the people, they mind about just pocket depth like that. So how many pockets, how much pocket depth, like that. So this is a problem. But once bleeding stopped, then just takes time, but pocket depth reduct.
They
Yeah,
reduct.
reduction,
Yeah. But for
yeah.
me, they are always a risk patient.
Sure, it's sure. Risk patient is another story.
Yeah, yeah.
Yeah,
So I'm always gonna
absolutely.
get them on a tight control and checking better if
Yeah,
like
yeah,
they
yeah.
have any change.
That's right.
Yeah.
So that's why just we need GBT, so in order to just recall
Yeah,
patients
exactly,
regularly.
exactly. To get them regular in the office to avoid
Yeah,
further problems.
that's right.
Why do you think that the Japanese they have this higher percentage of periodontal patients?
Because of Japanese dentists and the dental hygienists like me, just we concentrate into the your deeper pockets.
Okay, they
Okay.
forget about the
Yeah, yeah,
beginning of the
yeah.
disease.
That's
They
right.
just
Yeah.
want the heart and
Yeah, yeah, remarked in just only deeper pockets, and so this is a deep pockets, and just we have to solve it like that. So, but we have to just check the other side. We have to check shallow pocket and also
yeah.
with just only breathing. So it's very very important because of sooner or later it's coming to periodontitis.
Exactly. And how you feel, because you have more than 40 years of experience. So how you feel the evolution of your patients? They are stabilizing, improving.
Improving a little bit. So because of Japanese people, we never talk about just our opinion or request directly to dentist.
Okay.
Just really hesitate to talk about just their consideration. So then just once upon a time, just they follow to dentist easily. Okay, you have to remove this. Okay, please do it. Like
Also,
that.
they
Yeah.
accept the opinion of the dentist without questioning.
Yeah.
Oh, this is
So,
different here,
yeah,
for sure.
yeah, that's right. So this is a tendency in Japan. So, but nowadays, just a patient to talk honestly, just because I don't want to lose my teeth, or I don't need any painful treatment like that. Before they are really patient, become patient, and
Yeah.
also they followed to dental professionals doing performance.
So do you think that the older generation, they are more conservative, so they will always follow the dentist, and if the dentist
Yeah,
is
yeah,
over treating,
yeah,
they say yes,
yeah.
and the younger generation question more,
Yeah,
right?
yeah,
And this
that's
is
right.
good also for these different options of a treatment plan.
Yeah, that's right. Yeah,
Okay, so
exactly. So I prefer such like a style, just straight telling and also very, very just honest talking.
yeah, yeah, yeah.
It's much better.
Yeah, but it's part of your personality. You are really communicative every single time that I see you, and you
Thank you.
are well spoken and always transparent and direct also. So that's I really appreciate that.
Thank you.
So I had the opportunity to train also in your practice. How long are you in this same place?
Same place. What do you mean?
The
Same place?
I was able to practice on your dental practice to train some trainers there. It's more than 40 years that you are at the same place, or you move clinics?
No, just basically just I opened my own clinic 40 years ago.
40 in the
40
same
years,
place,
yeah,
like it
same
didn't
place.
change.
And
Okay.
still just keeping. And also the other side, I have a new one to the central of Tokyo.
I haven't seen that one.
So that means just I have to manage just two clinics.
Okay, and how is the management of the two clinics?
Okay, just on Monday, Tuesday, Wednesday, and Friday, this clinic, and also Tuesday, and also Thursday, this clinic, like that.
So and as a entrepreneur, because you are entrepreneur, if you have two clinics plus the school, do you think that it's easy to manage your time? Because I don't know, we are doing so much. I don't know how you do it.
Oh, because of collaboration with the dental hygienist and also my colleague.
Oh,
Just
yeah.
I'm working with the dental hygienist, same dental hygienist, more than 27 years. Yeah, working together.
Wow.
And the other one is just more than 17. And the last one is 12 years.
12 years, 17 and 27. Wow,
And now
this
just a
is
new person came. So, but she will just work a little bit longer. I hope so.
Yeah.
Anyway, just we have really longitudinal relationships and collaboration each other, and they understand about what I can do and so what I want to do. So everything just we share it. We
Yeah.
share the information. That's why just they are really cooperative to me.
Yeah, and I'm sure that you have also patients that is with you
Yes,
since
yes.
the beginning
Yeah.
of the opening of the practice.
Yeah, okay. The patient number one still just he is coming to my clinic and also 40 years. So can you imagine it?
Wow, that's a patient number one. I
Yeah.
wish to say that. So
Uh-huh.
that's
So
crazy.
yeah.
So tell me, how you think that it can go dentistry, not only in Japan but worldwide, because you are moving a lot. You are in Sweden, Switzerland, Tokyo. We had the opportunity to see each other 2 months ago in
No,
Korea.
in Korea, yeah.
Yeah, for a while. So how you think it's shifting dentistry?
I think just much more power of dental hygienist coming.
Oh, so
Yeah.
you see that the
Yeah,
dental
yeah.
hygienists are going to take even more.
Yeah. Then just dentist. Role of dentist is just will be just concentrated into diagnosis, making diagnosis, and also check full cover or covering just dental hygienist performance. For instance, just okay, admiring, and also otherwise just okay, good job, or such like talking, and then just okay, work more. Dental hygienist work more. So this is my idea, and also it will be just much more comfortable to patients.
Yeah.
So anybody wants to meet a dentist, but the dental hygienist to meet dental hygienist is relaxed and comfortable and nice to see you again or such
Yeah.
like a telling. But to dentist, oh, are you going to injection or are you going to grinding my teeth or are you remove my teeth
Yeah,
like
that
that?
kind of
Such a
hesitating.
scaring.
Yeah.
Because of this is my role, dentist role, and only dentist can perform. So that's why it's enough.
Yeah.
Yeah, it's enough. Then just in order to work as a dentist, so the treatment or such like a procedure, so then just I need environment, good environment. That means just environment caused by dental hygienist. That's why just collaborate each other. Always I'm thinking about the team play. Otherwise, just teamship, team approach.
Team approach.
Team approach that means just dental hygienist. They know what is the role of dental hygienist, and the dentist understand just the role of dentist. This is very important, and sharing together about the patients and information with the patients. So then working together is really enjoyable.
No, that's really cool. It's everything that I always preach. Also, it's the team approach and that
Yeah,
we need to work as a
yeah,
team.
that's right.
Yeah.
Yeah, exactly.
Takeuchi-san, you are a true inspiration. You truly are. So since the first day that I met you in Tokyo,
In Tokyo,
I really think this. I see your life work more than 40 years that you are knowing each time more and more about prevention and try to preach it also in Japan. Not only that, but training clinicians to follow the same approach and seeing how much you are building your treatment plan, building also the longevity of your patients and for you of your team on the dental hygienist as an original dental hygienist. It really makes it's a pleasure to me. So thank you so much for being on the podcast. It was really great to hear your story, know more about you, know more about Japan. I hope that the listeners also now will research you more because the work that you are doing is crazy good. So thank you so much.
Thank you very much. Thank you. My pleasure.
My pleasure. My pleasure. So to all the listeners, thank you for being with us and subscribe in any platform, Apple Podcasts, Spotify, or even YouTube. And stay tuned for the next episode of Smiles in the Air. Thank you. Bye.
Thank you.